It is everyone's favorite 10-minute meeting, our weekly metrics update. Let me jump in and share my screen because there is actually something somewhat interesting and new this week. Our agenda is going to be normal, excuse me, but the ODE came out and released some new guidance yesterday. So this is their new sheet. As you can see here, they have these different levels where now schools must open if they hit certain ranges. So good news, we've got 3 weeks of in the green. We even dropped from 16 down to 11 biweekly case count. So it just keeps going further down. This blue line, as you know, 16 down to 11. Our fantastic school nurses let us know that we're even down from 31 students quarantined the previous 2 weeks down to 21. Our yellow line is our positive students. Excuse me. 3 weeks in a row with zero. So we've had 0 positive students for quite some time, which is such an encouraging sign. And then finally, our staff quarantines is down to only 2 staff members quarantining due to COVID. And I believe, Megan McFetrich and Wendy, I'm looking at you, we have 0 positive staff members out of that too. So we just continue to be in fantastic shape. I mean, a month or 2 months ago, man, we couldn't have, made a better plan to just get these numbers completely dropping. So encouraging. Jason, you've been doing such a great job communicating on the athletics, getting that back, getting restaurants open. It's just, the sun is shining. It's just so encouraging. So, and I know, Katie, you always have some good insight. So with that, I'm going to move to everyone's favorite part of the meeting. Deputy Director of the Crew County Health Department, Katie Plum, giving us an update on where we're at the county level.
It is good news. Our county numbers are mirroring the numbers that we're seeing in our schools. It is fantastic to see. I know there for a while we were really monitoring the numbers of cases in our younger kiddos, our 19 and under, and we haven't had cases with our kiddos, which is great news. And really cases overall have gone way down. So that is awesome. We are continuing to encourage people to, keep wearing masks, keep distancing, stay on top of it. We are heading into spring break and a time when typically people do gather, we travel. So encouraging people to do those things and do them safely. We are at the health department continuing to ramp up our vaccine distribution. So we were scheduled for over 650 today, I know, and next week it's over 700 that we'll be distributing. So as we continue to increase our doses that are available, the number of vaccines that are coming into the community, we're also distributing vaccine to pharmacies, the hospital, Mosaic Medical, and trying to get as many other people and other entities available to get vaccine out as much as possible, because that will really help to keep our numbers down. Hopefully, through the summer, in the next school year, we are thinking long-term is how do we stay on top of this so that we can continue to keep numbers down so that we don't run into a big surge again in the future. So that's the goal.
Always so great. I just felt like for so long we would just come and be like, oh, numbers keep ticking up. And it's just it's fun to just be like, yep, more opportunities, numbers keep going down. It's fun to be a part of.
Yeah.
Katie, I think now it's time to turn to everyone's favorite part of the meeting, our 2 school nurses. I don't know if you guys have caught on. I say every part is everyone's favorite part. So just so you know.
I think, Joel, Dr. Hoff, this is just your favorite meeting overall.
It is. It is. We're going to miss this someday. All right. Everyone's favorite part of the meeting, our school nurses. Wendy, Megan, thanks for joining. What do you have for us?
I'm not sure. I don't even know what to say, Joel. I don't have a whole lot. I mean, Wendy and I very little call. I mean, still kids sick and testing and negatives, but I mean, nothing too exciting. More stomach bugs than not.
Back to the old regular illnesses that we would normally see.
What I was going to add, and that is a perfect segue, is that one of the trends that we have seen at the health department is we are noting people coming in for other things, right? And so our typical services are still being offered, and so it is nice to see that starting to pick back up again. So I mean, not that there's other things happening, but people are coming in for care for things other than COVID, which really is good. And that those services are still being offered.
Very cool. Wendy Perrin, you got anything for us?
Not really. We'll just keep on tracking students and staff. So communicate with us if you have concerns, questions. We're here.
Guys, with that, it is 4:08, which I think would tie our record time. So, but I don't want to cut anyone off. Do we have anything else besides have a fantastic spring break and keep up your precautionary measures? All right.
Good message.
We'll end on that. Keep following the school district and school Facebook pages. Lots of great information. Thank you everyone in this meeting for all your hard work. And I'm telling you, we are going to miss these Tuesday meetings someday. Maybe not. I will. All right. I hope you guys, everyone does well, and we'll see you. Actually, have a great spring break. Bye.
Thank you.